Welcome back from that commercial break. Remember, this is Health Port. This program is brought to you by Makerere University School of Public Health, together with Family TV. And today we are looking at labor experience. We have Fatna, Garenda, together with Sylvia. And Sylvia is taking us through the components in the mama kit. So, Sylvia, before we went for the commercial break, we are looking at the gauze and how you can actually make a pad out of it.
Yes.
Can we continue with that?
Thank you so much. Welcome back, our dear viewers. Now I'm going to show, this is the cotton I was meaning. We cut it off from this other roll. And the gauze is here. We have also cut it off from this other roll. We use the clean razor blade. We use the clean razor blade to cut that.
Which is also a component in the mama kit.
Yes, it's a component in the mama kit. So I want our viewers to see how we make the pad. The cotton is here. It is flat. Put it onto the gauze. Bring this other end here. And bring this other end here neatly. This one can be done by the mother or anyone helping her, the husband. You can get involved in making perineal pad. We call it a perineal pad. We use it after the delivery, or when we examine the mother and we see that there are discharges which are coming, because we don't want her to feel the slipperiness, we use the pad. And this is the way we make it.
Okay.
Another component in the mama kit, there is a piece of soap. This one you can buy from the shop when you are preparing your pack, because it is for cleaning. You use it for bathing.
In others, they can buy any type of soap.
You can buy any type of soap.
Either laundry or baby
yes.
soap.
Yes. Government helped when they were making this pack. They put this tablet of soap. There is a clean razor blade. The razor blade is to help during the cutting of the cord. Should delivery occur when the scissors are not there, because in the hospital we use a delivery pack with the delivery instruments. But should the moment reach that the delivery instruments are finished, for one reason or another, we can pick the razor blade which is in the mama kit. There is a polythene, this kavera here. Maybe you shall also open it. It's a very big kavera. When we cut it in, we can get two pieces. You can get two pieces of polythene from this. Yes. So when we cut it, we shall use one before delivery, and then after she has delivered, because there will be a lot of soiling, a lot of blood, a lot of other stuff, we make her to sleep in a clean kavera. It's called a Macintosh. So
what else is in the...
Another piece of kavera is here. This is for the baby. Yes, this is for the baby. We are looking at the baby because we want our baby to remain safe after that. And there are two pieces of...
So it is so small, like a baby?
Yes, like a baby. But still it can widen further than that.
Oh.
Yes, like that. That is for the baby. So if you are buying these Macintoshes from the market, buy
and
one.
And the materials also differ?
Yes.
They are different?
Yes, they are different. So when you are buying in the open market, get 1 meter by 2.
For the mother or
for the mother? For the mother. Because it can cover the entire bed where the mother will be sleeping.
What about for the child?
For the child, you can buy 1 meter by 1. 1 meter by 1. Because the child does not take the entire bed. Then we have 2 pieces of cotton thread. This thread is for tying the cord. We tie the cord at birth at 2 points, and then we separate the baby from the mother. So that is part of the mama kit. In other mama kits, government sometimes puts a towel for the baby. But for this particular kit which we saw, there was no towel for the baby. Nonetheless, the mother should prepare baby's clothes. Baby's clothes in the bag. We called it mama's bag. So this is baby's cloth. You can have like 5 pieces, because we use 1 piece at birth to dry the baby, and then after there, the baby will need warm clothes, bed sheet. You can buy 1 bed sheet and separate it into 4. Yes, cotton type, not polyester, preferably cotton. Like this is cotton. You can go to the market, buy 6 pieces, wash them, iron them, and pack them in the bag. Like this one was not in the mama kit, but it's in the mama's bag. Yes, it's in the mama's bag.
So what else is the mother supposed to carry to be prepared with?
When mothers come in labor, some tend to vomit. Others reach when they have moved on the roads, on the motorcycles, they may feel that they are dirty. They need to bathe. So we need a basin or a bucket, 10-liter bucket, to help her for bathing. In case she wants to vomit, okay, she uses her basin to vomit in there. After delivery, the baby will need to bathe. If she's able, she can get 2 basins, 1 for herself, 1 for the baby. But in areas where you can't afford getting 2, 1 basin will be for the baby, then the bucket will be for the mother.
Okay.
You need to have a cup for tea, because in labor we tell them, "Nywe chai." Where will she put the hot water? In case I have boiled water and I want to give her the water, she should have a cup.
Do you offer that service or?
Yeah, sometimes we do offer the service. And also, our patients get breakfast. The hospital supplies breakfast, porridge. So you should have a cup for the porridge. They supply food, lunch. They serve them with lunch. You need a plate. Then when the midwife is saying, take a cup of tea, you need sugar. So sugar is part of what a mother should prepare. Even a packet of tea. Yes, we encourage them to take the sweetened tea. So we shall need everything that makes you able to take that tea. Most importantly, the male involvement.
Exactly. Actually,
the husband is one of the things we consider as part of the preparation, part of the requirements. We need the husband's support.
In all this, what is the husband's role in all this preparation?
Edrine, thank you so much for this question. And I know our viewers out there, they are like, she's now coming to tell us a lot of things. But as a husband, first of all, you have to give support, psychological support to this mother. Be with her. Your presence alone means a lot when the mother comes for labor. It is the husband to facilitate.
Like we've been actually, like
yes, all these things here. If she has not been able to get the mama kit, she should buy. And what is she using to buy the items? So the husband facilitates her with money to buy these items. Then physical being there to support her. Remember, we were talking about back pain in labor. That back, she will be saying, "Whoa, massage me the back." So when the husband is there, I allow them to come.
Some husbands say that the reason that's why they don't support their wives during that moment is because when they see the husbands around, they become too lazy to push the child. So maybe this is the reason they don't want to be around.
That one may be simply an excuse, which I really don't want to buy or to tell our viewers. Please, husbands out there, it's your role to support your wife to the end. And when a husband escorts a mother, the midwife feels so happy. Because part of the work that the midwife would do, the husband is there, like psychological comfort, psychological support. This labor moves normally when the mother's mind is also at peace. But if the mother is stressed for one reason or another, maybe the husband has not responded when she called that she's in labor, has not responded, her labor may become distorted, may become abnormal, simply because the mind has been disturbed. So husbands out there, you have a great role. When the baby is born, the husband can carry the baby, can help the mother to carry the baby as she goes to bathe. You see? Some like the Muslim community, the moment the baby is given to the husband or to the father, she prays. There is a prayer. They pray over the baby. That one all comforts the mother, you know. So husbands out there, you have a great role to play. When labor begins, you are the one to look for transport and bring the mother for skilled attention.
Well, thank you so much, Sylvia. We are indeed grateful for today's program. And next time when we meet, we are going to talk about now the role of the midwife, because we've looked at the role of the mother, the role of the father to be, and of course what you need to prepare yourself with. So next time when we meet, we are looking at now the role of the midwife. Thank you so much for watching today. But of course, I'm Edrine Osteen Mukalazi, together with Fatna, Garenda, and then Sylvia, our senior midwife, who has been taking us through this whole lesson. I work with Jonaja, the producer, Bantam in transmission, and Tony Santo on social media. Thank you so much. Enjoy your weekend responsibly, and good night.
Bye-bye.